Before you schedule your next routine checkup, you need to hear what I am about to tell you. If you are over 60, there are 5 common medical tests being offered to you right now. Tests your doctor may call standard, even essential, that could quietly be doing you far more harm than good. I am not talking about rare edge cases. I am talking about procedures performed on thousands of seniors every single week that the latest research shows may be increasing your risk of falls, unnecessary surgery, kidney damage, and a complete loss of the independence you have worked your entire life to protect. My name is Dr. James Harlow. I have spent over 28 years working in geriatric medicine, and I have sat across from too many patients who walked into a routine screening feeling perfectly fine and left with a chain of interventions they never needed. Interventions that changed the course of their lives in ways nobody warned them about. We call it the cascade effect. One test finds something minor. That minor finding triggers another test. That test triggers a procedure. That procedure triggers a complication. And suddenly, a healthy, active 78-year-old is sitting in a rehabilitation center trying to remember how they got there. Today, I am breaking the silence on 5 of the most commonly recommended checkups that, after the age of 60, carry risks that are rarely explained to you before you agree. Because here is what I have learned in nearly 3 decades of practice. Being an informed patient is not just about knowing what tests to say yes to. It is equally, and sometimes more importantly, about knowing when to say no. And that knowledge could protect your health, your dignity, and your freedom far more than any scan ever could. Before we go through each one, I want to ask you something. Have you ever left a doctor's appointment feeling like something was being done to you rather than for you? Like the machine was moving forward and your voice was simply not part of the process? If that feeling sounds familiar, write the word yes in the comments right now. And tell me your age because what I am about to share applies very differently depending on whether you are 62, 72, or 82. Let us begin with the full body scan. Private clinics market this aggressively. The promise is seductive. We will find everything before it becomes dangerous. It sounds like control. It sounds like peace of mind. But here is what the glossy brochures never mention. When you place a healthy adult over 60 inside a whole-body MRI or CT scanner, the data is unambiguous. In roughly 95% of cases, the radiologist finds something. Not something dangerous, not something requiring treatment. Something the medical community calls an incidentaloma, a completely unintended finding. A small shadow near a kidney. A faint nodule in the lung no bigger than a pencil eraser. A tiny cyst that has likely been sitting quietly for decades, causing absolutely nothing. But here is where the trap closes. The report comes back with the phrase observation recommended, and your peace of mind evaporates instantly. Anxiety drives you towards specialists. The specialists suggest biopsies. And a biopsy in a person over 70 is not a simple procedure. It often requires sedation that can leave the brain foggy for days. It carries real risks of bleeding and infection. And the most alarming part? Studies consistently show that people who undergo full-body scans do not live a single day longer than those who skip them. They simply spend more of their remaining time in waiting rooms and recovery wards, chasing shadows that were never a threat. If you feel strong and functional, if you move through your days without significant limitation, that is your scan. That is your real data. Do not let a machine convince you that your body is broken when every lived experience tells you otherwise. The second checkup that deserves serious reconsideration after 60 is routine stress testing on a treadmill or stationary bike, particularly when ordered before a planned procedure like knee surgery or cataract removal. The reasoning sounds logical. Before we operate, we need to know your heart can handle it. But in older adults, this test has a fundamental and rarely discussed flaw. The stress test measures your heart's response to intense exertion. But after 60, your heart simply does not accelerate the way it did at 35. Medications dampen the response. Natural aging changes the baseline. So the machine flags a reading that does not match the expected pattern for a younger adult. The cardiologist sees that flag and sends you for a cardiac catheterization, an invasive procedure in which a thin tube is guided through an artery all the way to your heart. Here is what they almost always find. Calcification, plaque deposits, the kind that are entirely expected in a 72-year-old cardiovascular system. Normal aging, documented on a report, is now treated like an emergency. Stents are placed, blood thinners are prescribed, and landmark trials have shown clearly that in patients without active symptoms, stenting does not extend life beyond what good medication and regular movement already provide. So next time a stress test is ordered before a routine procedure, ask yourself one question. Can you walk up 2 flights of stairs without chest tightness or struggling severely for breath? If the answer is yes, your heart has already passed the most meaningful test available. Your daily life is your stress test. Trust it. I want to pause here for a moment. I know this information can feel like a lot to absorb, especially if you have trusted a particular doctor for many years. I am not asking you to walk away from that relationship. I am asking you to walk into it as an equal, someone who asks questions, who understands risks, and who makes decisions based on your individual life. Have you ever pushed back on a test and found your doctor actually respected you more for it? Write your experience in the comments. Your story may be exactly what someone else watching today needs to hear. The third checkup I want to address is carotid artery ultrasound screening. This test examines the major blood vessels in your neck and is often offered as a private add-on service, marketed as a way to detect narrowing before it triggers a stroke. For patients who already have symptoms, sudden vision changes, weakness on one side, or brief episodes of confusion, this test can be genuinely life-saving. But for a person over 65 with no symptoms whatsoever, the picture changes dramatically. If significant narrowing is found, the pressure to intervene becomes enormous. Surgeons discuss procedures to open the vessel. What the conversation rarely includes is this. Operating on a calcified carotid artery carries a real risk of dislodging plaque, which then travels to the brain and causes the stroke you were trying to prevent. The risk of the cure can rival the risk of the condition itself. Major health advisory bodies have recommended against routine carotid screening for people without symptoms. Modern blood pressure management, cholesterol care, and lifestyle habits have reduced stroke risk so significantly that the math simply does not favor surgery when you feel fine. A quiet artery is a safe artery. There is no reason to disturb it. The fourth checkup, and this one is emotionally charged, is cancer screening that extends too far into advanced age, specifically PSA testing in men over 80 and mammography in women over 80 with consistently clear past results. For decades, the message has been absolute. Screen early and save lives. That message is true and important for adults in their 50s and 60s. But biology shifts after 80 in a way that medicine has been slow to openly acknowledge in patient conversations. Autopsy studies confirm it repeatedly. The majority of men over 80 have prostate cancer cells, but nearly all of them die of something else entirely. These are slow-moving cancers that, had they never been found, would never have caused a single symptom in the years they had left. When we screen for them and find them, we cannot simply choose to look away. The system creates immense pressure to treat. And treatment for an 82-year-old, whether radiation or surgery, carries consequences including incontinence, chronic fatigue, and a collapse in quality of life that can be irreversible and permanent. We are targeting a condition that posed no real threat while creating damage that is very real. The same principle applies to certain screenings in older women. A minimal finding in a woman in her early 80s who has never had an abnormal result can set in motion surgeries and recoveries that fundamentally alter her remaining years. Sometimes the most medically sound decision is to observe rather than intervene, and to protect quality of life as fiercely as we protect quantity of life. I want to ask you directly, has someone in your family gone through treatment for a cancer found through routine screening? A treatment that left them weaker, not stronger? Write their age in the comments. These stories matter. The fifth checkup that seniors deserve a complete and honest conversation about is the colonoscopy after age 80. Let me be clear, between the ages of 50 and 75, the colonoscopy is one of the most effective preventive procedures in medicine. It has saved an enormous number of lives, and that is not in dispute. What changes after 80 is the biology of the colon wall itself. It thins with age. Physicians often describe it as resembling tissue paper compared to what it looked like at 55. When an endoscope is advanced through this fragile environment, the risk of puncturing the colon wall increases significantly. A perforation in a patient over 80 is not a recoverable inconvenience. It is a life-threatening emergency requiring immediate surgery, with outcomes that frequently include a permanent colostomy and a hospital stay that can permanently alter independence. The preparation alone is a serious risk. Consuming large volumes of laxative solution strips the body of fluid and electrolytes. For an aging heart and kidneys already working less efficiently, this level of dehydration is a genuine physiological threat. A reliable alternative exists. The stool-based occult blood test can be completed at home, requires no preparation whatsoever, carries zero physical risk, and provides meaningful monitoring for any signals that something requires attention. It is not a compromise. For the vast majority of people over 80 with a clean history, it is genuinely the smarter, safer choice. If your previous screenings have been clear and you are over 80, this is the path that protects you. Now let us talk about what you do with all of this, because information without action is just worry. I want to give you 3 concrete questions to memorize before your next appointment. These are the questions I would ask on behalf of my own family members sitting in that chair. First, will the result of this test actually change my current treatment plan? If the honest answer is not really, the test may not be serving you. Second, what are the specific risks of this test at my age given my current health? Make your doctor spell it out. You deserve numbers, not just reassurance. Third, is there a lower risk alternative that gives us the same information? Very often there is. Very often no one mentions it until you ask. These 3 questions are not acts of defiance. They are acts of partnership. Every good physician I know respects a patient who comes prepared. And if your doctor becomes dismissive when you ask them, that itself is important information about the care you are receiving. Here is what I want you to carry forward from today. Aging is not a malfunction. Your body at 70, at 80, at 85 is not a system full of errors that urgently need to be corrected by technology. It is a living system with extraordinary resilience that deserves to be supported, not constantly interrogated. True health in your later years is not measured by what your scans look like. It is measured by whether you wake up each morning feeling capable, by whether you can sit with the people you love, move through your days with confidence, and protect the independence that makes life worth living. That is the standard worth fighting for. That is the standard worth protecting. If today gave you something real, something you are going to use at your next appointment, share this video with one person you care about who is over 60. Because somewhere right now, someone is being handed a referral form for a test they may not need, with risks nobody is explaining clearly. Your decision to share this might change that. Subscribe so you never miss another evidence-based conversation about staying strong and truly healthy as you age. And drop a comment right now telling me which of these 5 checkups surprised you the most. I read every single response, and your question may shape the very next video we create together. Your voice matters here. I am Dr. James Harlow. Stay curious, stay informed, and above all, stay well. The information in this video is intended for general educational purposes only and does not constitute professional medical advice, diagnosis, or treatment. Every individual is different, and all medical decisions must be made in close consultation with your personal physician based on your complete health history. Never stop or adjust any prescribed medication without speaking to your doctor first. Always seek qualified professional guidance before making any changes to your care.